To start off some of these presentations. We have quite a few diverse presentations here, and so we'd like to get that ball rolling and hear from a lot of the people that we've invited. So we wanted to start off with Emily Hoazous. She has worked on a health impact assessment project through a grant in partnership with the Santa Fe Indian Center. And she can tell you more specifically about it, but it was a very meaningful partnership, and the outcome she'll talk about, but we're really pleased that she was able to participate and get some good information from the Santa Fe Native American community. So Emily, I'm not sure. Oh, sorry. It's hard to see everybody here with all the wind. Thanks, Em.
Pin this to your coat.
All right. It's all right if I... Good afternoon. Hi, my name is Emily Hoazous. I'm here as a native Santa Fean, a voter, a member of the Chiricahua Fort Sill Apache tribe. I'm a mom. I'm a member of our urban American Indian community here in Santa Fe. It's kind of neat here to be speaking right, that's my grandpa's sculpture right there. So one of the things I think my grandpa would say is, if you're cold, get out of the shade. It's nice and warm over here. So if you're back behind grandpa's sculpture, move forward. So I want to talk today about a project that we just finished. As Mary was saying, the New Mexico Health Equity Partnerships together with Kellogg funded a health impact assessment project that we did. We looked at the health of our Native community in Santa Fe so we could make recommendations to the community, our elected leaders, and our tribal leaders about how we want our Indian Health Service dollars to be spent and how we think the Indian Health Service should look in the future. Now, the community voice in this project was strong. Our advisory board gave us clear guidance as we spoke to people throughout Santa Fe, helping us focus on the issues that they felt were the most important to Native people here, most relevant to the IHS facility in Santa Fe. We were able to collect surveys from approximately 5% of our Native community, which is pretty big, actually. We interviewed a number of individuals so we could get even more focused information related to our findings. And let me tell you about what we learned. We learned that we have wonderful diversity here in Santa Fe with our tribes. In the data that we collected, we had about 155 different tribes represented. We learned that people feel that the way that the federal government rations funds for Indian Health Service is discriminatory, particularly when it comes to access for specialty care. Let me say it again. Is really reinforcing what I'm saying here. It's like the earth is helping me. It's an exclamation point. The way the federal government rations care is discriminatory. Many of the people we spoke with understood that the Indian Health Service is a treaty-obligated right based on promises that the federal government made in exchange for our land. The Indian Health Service is not insurance. It is a healthcare delivery system. And this is a healthcare system that we can go to for healthcare, but for Native people, for Native people, when we go there, depending on where you live, you only have access to certain healthcare services. And people who talked to us in our project really believed that it wasn't fair the way that we could access that care. We learned that Native people are putting off seeking health care because they don't qualify for purchased or referred care funds. We used to call that contract health service, but now it's purchased referred care. More than half of the respondents said that they put off seeking care for the condition in the past year because it couldn't be treated at IHS. So, for examples, we spoke to someone who didn't receive care for a heart condition because IHS had no way to pay for this based on their payment system. A heart condition, this is a life-threatening condition. When people did qualify for payment through other means such as Medicare, there were substantial delays that prevented patients from receiving timely care. So another person that we talked to had a cancer diagnosis. She was denied treatment at one facility, so she had to get approval to get treatment at another facility. But then she had to wait several months before she could start treatment. Then, once she got that approval, she had to find a way to get to that facility to start her chemotherapy. But she didn't have a car, she couldn't afford the train, and so she had to rely on her friends and her family to get her there, or she had to rely on a shuttle. But you can imagine, if you have cancer, trying to find somebody to drive you back and forth to Albuquerque to get your cancer treatment, it's a really unpleasant way to try and get this life-saving treatment. We talk to people who don't have life insurance. They make more money or they make enough money so they don't qualify for Medicare or Medicaid, but they don't make enough money so that they can afford to pay for the premiums and the co-pays that you have to pay for. I have to brace myself here. They don't make enough money to pay for the premiums and co-pays that you have to pay for when you have health insurance. So they just keep their fingers crossed that they have good enough health to see them for the foreseeable future. But that's not a sustainable way to think about your health care. We learned that people have a strong sense of ownership for the Indian Health Service Hospital here in Santa Fe. This is our hospital. We're born there. We've had family members die there. We've been cared for there our whole lives. We like the people who work there. Some of us are related to those people. Some of us are those people. We want to do what we can to support the hospital. We believe in that hospital. Disturbingly, we learned that our Native American community is living with food scarcity in a world of abundance. We learned that people in our community are going hungry on a regular basis. More than half of the people in our survey are rationing food at least sometimes because they don't know how they will pay for it. Half of the people in our Native community are rationing their food at least sometimes because they don't know where they will find the money to pay for their food. One of our recommendations is that we find ways to partner with food banks so that we can bring the food to our Native communities to help address this problem. We learned that mental health is a serious concern for our Native community. Whether it's treatment for addiction or simply just family therapy to help keep our families strong, people identified cultural, relevant mental health services as a priority for health promotion. As one person said to us, if you're mentally healthy, then you know how to be physically healthy, spiritually healthy. You're working with your mind to make your mind healthy. Mental health impacts all of our relationships. It affects your ability to problem solve, your ability to function in the world. Putting a focus on Indigenous health could have radical implications on our community health. When we think about Native American health, we hear so much about what's going wrong. It's time that we talk about what we can do to make it right. Let's build our conversation around our strengths as Indigenous people, about all that we do well, our resiliency, our communities, and our incredible ingenuity. Indigenous health is about integrating mind, body, spirit, and intellect. There's no reason why we can't have state-of-the-art healthcare. The IHS can and should be an example of the best healthcare system in the world. When we prioritize Native health, we will see a ripple effect among our communities. We must help our leaders understand that healthier communities live longer, are able to go to school more days of the year, are more productive at work, and are happier at home. We have the knowledge of what needs to be done to improve our health care. Now it's time to share what we know with our tribal leaders and elected officials so we can change our health for the better. Thank you. Yeah.